If you're a woman in your 40s or 50s and you've noticed more hair in the shower drain, more hair on your brush, or a widening part at the top of your head, you are not imagining it. Midlife hair loss in women is extremely common, but it's also under-discussed, under-tested, and often dismissed as just aging. Today we're going to talk about what actually causes hair loss in midlife women, which tests are worth asking for, and what treatments truly have evidence behind them. Many women describe the same moment. You're styling your hair like you always have, and suddenly the scalp is more visible, the ponytail feels thinner. Photos from a few years ago show a very different hairline. For a lot of women, this is more than cosmetic. It affects confidence, social comfort, and even how well or healthy they feel. So let's start with why this happens. One of the biggest drivers is hormones. During perimenopause and menopause, estrogen and progesterone decline. These hormones don't just regulate periods, they also influence the hair growth cycle. Estrogen tends to prolong the growth phase of hair. When estrogen drops, more hairs shift into the shedding or resting phase. At the same time, androgens, like testosterone and DHT, can have a relatively stronger effect at the hair follicle. For some women, this leads to female pattern hair loss, thinning along the crown, a widening part, but usually maintaining the frontal hairline. This is different from male pattern baldness, but the mechanism is related. Hormones aren't the only factor. Another major contributor is thyroid function. Both low thyroid, hypothyroidism, and overactive thyroid can cause diffuse hair thinning. So if hair loss appears suddenly, especially with fatigue, weight changes, sensitivity to cold or heat, or menstrual changes, a full thyroid panel is absolutely worth requesting. We also have iron and ferritin levels. You can have normal hemoglobin, but still have low ferritin, which is your iron storage. When ferritin is low, especially below a certain threshold, the body may reduce non-essential functions like hair growth first. Many midlife women have heavy periods before menopause, changes in diet, or low-level inflammation, all of which can deplete iron stores quietly over time. Checking ferritin is a simple blood test that's often overlooked. Then there's stress and illness. Any major stressor, physical or emotional, a surgery, a COVID infection, a major life event, can trigger something called telogen effluvium. That's when a larger than normal number of hairs shift into the shedding phase all at once, usually 2 to 3 months after the event. Women describe it as, "I'm losing handfuls of hair." The good news is, this type of hair loss is usually temporary, and regrowth is possible once triggers are addressed. So when should a woman say, "I need this evaluated," and what should she ask for? If you notice clearly increased shedding, a widening part, new thinning on the crown, or a patchy loss, it's reasonable to ask your clinician for a thyroid panel, TSH, free T4, sometimes free T3, ferritin and iron studies, vitamin D level, and, in some cases, hormonal evaluation, particularly if cycles are changing or other perimenopause symptoms are present. In some situations, a referral to a dermatologist who specializes in hair disorders can be extremely helpful. They may examine the scalp more closely, do a pull test, or occasionally recommend a biopsy if the pattern is unclear. What about treatments? Let's talk about what has evidence behind it. First, topical minoxidil. This is one of the few FDA-approved treatments for certain types of female hair loss. It can help prolong the growth phase of hair and increase hair density in some women. It takes several months to see results, and consistency is key. Second, if androgen-driven hair loss is suspected, some clinicians use oral medications that reduce the effect of androgens at the hair follicle. These are prescription treatments, like spironolactone or finasteride, and they're not for everyone, so risks and benefits should be discussed carefully with a knowledgeable doctor. There is also growing interest in PRP, platelet-rich plasma, scalp injections, low-level laser therapy caps, and nutraceutical supplements designed specifically for hair. The evidence for these varies, and costs can be significant, so it's worth asking your clinician which options are realistic for your situation and budget. Third, addressing underlying issues, correcting low ferritin, optimizing thyroid function, treating scalp conditions like seborrheic dermatitis or psoriasis, and managing chronic stress. These are not cosmetic steps, they're medical. Most importantly, if you are experiencing midlife hair loss, please know this. You are not vain for caring about it. Your distress is valid. Hair is deeply tied to identity for many women. You deserve to be heard, to be evaluated properly, and to have real options. Midlife is a time of major hormonal and metabolic transition. Understanding what's happening on the inside can help you make sense of what you're seeing on the outside, including your hair. And with the right workup and a thoughtful plan, many women do see stabilization and regrowth